A grim tally has brought back the focus on Japan's mental health crisis, as data released by the government reveals that more people died by suicide in a month than COVID-19 in almost a year. In Japan, suicides in October this year claimed more lives than the COVID-19 infection did in 2020 so far. 2,153 people died by suicide till October, while the country's total COVID-19 death toll is 2,087. Unlike most countries, the impact of COVID-19 has not been very severe in Japan, but a deeper analysis shows that the country's existing mental health crisis has been made worse by the pandemic. Japan has the world's second highest suicide rate after South Korea. Long working hours and societal pressure, coupled with stigma around mental health, said to be some of the factors behind this grim figure. However, recent data suggests COVID-19 has taken a disproportionately higher toll on women, while more men than women have died by suicide. The number of women taking their own lives has been on the rise. In October, suicides among women in Japan increased by almost 83%. Compared to this, male suicides rose by almost 22% over the same time period. Many females who were employed as contract workers lost their jobs during COVID-19. As women make up a larger percentage of part-time workers in the hospitality and retail sectors, which have been hard hit by COVID-19, there has also been a rise in sexual abuse and domestic violence, as unlike before, women have been forced to remain confined to home even if they face a hostile environment. Women have also been overwhelmed due to increased responsibilities at home, including looking after children. As schools and daycare centers remain shut, it must be noted that Japan remains a patriarchal society where the household work is rarely divided between men and women. And our correspondent Grace Lee has been tracking these developments very closely, sent us this report from Tokyo. Take a look.
Unfortunately, according to analysts, Japan is one of the few developed countries that releases suicide data very frequently and very up to date. For example, the last known set of data that we have from the U.S. is from 2018. So we are seeing close to real-time numbers of what suicide data looks like here in Japan. And so analysts say that perhaps this is indicative of what we are seeing around the world, although we may not have the data yet, of how much COVID-19 is having an impact on mental health. And of course, you mentioned that women were disproportionately higher to be susceptible to suicide. And that, of course, does point to the fact that many women have been suffering from the added burden of childcare issues that have come up through COVID-19. And we are seeing a lot of that here in Japan, but women around the world are suffering from that hit.